The World Health Organization (WHO) declared the novel coronavirus COVID-19 a pandemic on March 11, 2020, a virus that first surfaced in a Chinese seafood and poultry market in the late 2019. Governments across the globe have since taken measures to contain the spread of the virus. Uganda, among the affected countries, registered its first COVID-19 positive case on March 21, 2020, and has since recorded 1,103 confirmed cases, with 2 deaths as of 27 July 2020. To contain the spread of the virus in a vibrant Ugandan society, the president ordered the closure of all learning institutions and businesses, religious, public and social gatherings, and all borders were closed, with travel in and out of the country banned on the 18th of March 2020. Upon registering the first infection and the subsequent rise in the number of cases of COVID-19, more restrictive measures were put in place, among which included the suspension of all public transport, suspension of the trading of non-food items in markets, and the enforcement of a curfew that ran from 7 p.m. to 6:30 a.m. daily. The measures put in place have, however, taken a toll on most Ugandan families, especially the women working across all sectors.
After COVID, things went further down because we had to suffer because of the borders being closed down and all that. We weren't having the also buyers coming in, people taking bulk, mainly the Congolese and the Kenyans. Those are like our biggest customers in this business. So when the borders were closed, business went low. During the lockdown, most of the traders weren't allowed to access their goods in the shops. Besides, as the lockdown went on, we didn't have the transport, so it was hard getting even to town. When the president opened our businesses like the arcades, still we've been facing issues with the landlords because they want their money regardless of whether you've worked or not. They don't want to know.
71% of Ugandan women operate in the informal work sector, such as retail business, markets, hospitality, street vending, and petty trade. All these business ventures require daily activities to earn an income, and thus the women depend on a daily earning.
Most of my friends, because I keep interacting with different traders, they had not so many options, because you may find someone who only has their business, they have no side hustles. So the options they had is savings and encroaching on the capital they had. Yes.
Without savings to rely on during the lockdown, many women traders continue to operate out of a sense of necessity and desperation, leading to violation of some of the set measures. In April 2020, 60 women market vendors in Lira, in northern Uganda, were arrested and detained for 1 month for violating the social distancing and curfew guidelines.
Karama cha wango mogo kere te do hotel ni na chiel ke yi kere police te bini diku chon cha chiel nu ino nga ker mogi keno a ker da chiemi keno te bino cha ko kera ni bini bet ping kan ati war ro bet ping ro ko bani hana to ro chi ka mem se no gola ni mi re pe cha dia mi pe bele la yo pe cha no eno gini ma ha gino ko ya me gino ko bokitu ino nga na tia we ha tini yo tino no ni no ko ade do kwa yegi me wara matin yo nga ma kwa gi ko gina gin te mana ma chiel to ko be wan pa wi ko no onyu gini pi ko yi ko no to onyu gini ma wa da ko to do wrong gini yu pi te bina gwara wa gin ter wa gina ko CPS ikunu te cha ko na cha na tin cha ko cha chiel nu no na hana cha par chiel Inte kwanyo watero wagini kot. In joni me yele ni te wod gini me temo yele dir du me kwanyo wagini. Eto pete lare te kwero gini doko. Ota rimane ngwa ko kunu tero wagini kwania. Ni wano bet kunu na ni ndo pie de wano tudu gi kot. Ani kar me dongo bedo da kam piele bedo yele pe wa bedo logini. Te duogo wagini kot ameni de pie de kia pot poroma. En gin tu yele ta kwanyo wagini nin kot. Te duogo pashu.
With the lockdown of markets, arcades, and business selling non-essential items such as clothes and shoes, among others, women traders have been forced into extreme measures for survival due to the reduction in customers and restrictions in movement, and they chose to sleep for months in the market despite the harsh conditions.
Covid yatuyisizza bubi kusinziira Covid bwezenge tawanya abantu kola buli kimu transport lya awakabana tetukyabalaba yenda okutambula transport abamuyitirivu toyina kyolya toyina kyonywa abaana babeera eri bayisibwa bubi naye nga awalala tetuyinaki netutandika okwebaka wano naye era tubeera safe tewali kizibu kyonna naye kati era twalibadde tuddayo awaka naye era transport mungi.
With limited or no investment capital left, they are in fear and uncertain of what life will be like post-COVID.
Corona bwasigalawo era tujja kusigala nga tusula mu katale kubanga transport mungi kizibu ekiriwo kya transport.
Among the measures taken by government was the closure of the educational institutions. Teachers have since the month of April not received salaries.
They stopped paying us salary in March. Now from March up to today, they are not paying us because they are telling us they are not also working. So they told us to get some small business where we can earn a living.
The National Private Educational Institutions Association has engaged the government to consider supporting private education institutions in payment of salaries for teachers for at least 1 year, but in vain, as the government notes the lack of money to fund payment of salaries.
As a teacher, I love my profession, and if schools open, I'll go back.
The teaching sector is said to provide employment to a substantive number of female teachers in addition to the non-teaching staff. Teachers have since resorted to doing odd jobs such as hawking food items, running kiosks, among others.
Before COVID, I was doing well and I'm still a teacher, but because of this COVID situation, so I switched to a small business and I'm selling avocados and bananas.
The COVID-19 pandemic has also taken a toll on the care economy, especially the domestic workers. Engaging in domestic and care works puts domestic workers at the forefront of maintaining livelihoods and economies, and at a higher risk of both being affected by the virus and the policy responses to the pandemic, such as border closures, lockdowns, and curfews.
Covid empisiza binnyo olw'ensonga nti tewabadde entambula wadde kati entambula yakomawo era tukyatambuza ebigere olw'ensonga nti transport eri waggulu ate ba domestic waka baffe abamu tebalina mirimu kubanga abaana bali waka ababoosi babayimiriza tebakyabeetaaga olw'ensonga nti abaana bwe bali awaka bakola emirimu. Eyali akola ennaku 3 kubanga ffe tukomawo awaka, eyali akola ennaku 3 akola lunaku lumu. Abaali basulayo ng'afuna emitwalo 10 babawo abamu emitwalo 6, 7 olw'ensonga nti abaana we bali kubanga omugagga ayinza okubuuza kati nkuzeeyo awaka kuba abaana we bali nange sikyakola kati olw'okuba nti akasente okeetaaga bw'aba badde akuwa emitwalo 10 n'akugamba nja kukuwa 7 oba 8 tubagamba ne bakkiriza tubakkiriza kuvaayo olw'ensonga nti emu esinga 0.
Most are now faced with multiple vulnerabilities such as termination and reduction in or non-payment of wages and salaries.
Bafunye obuzibu bw'amaanyi nnyo olw'ensonga nti abamu tebasasulwa. Omugagga kugamba beerawo okole bwe naddayo kola nange nja kusasula. We bali bakola ne bakolera mu bugubi obw'amaanyi kubanga lockdown nga bwe yatandika yali eyokya nnyo nga mbi nnyo abasinga baakaddayo kukola naye ng'era n'abaasigala nga bakola bakyabanja emyezi egy'emabega egya lockdown tebannaba basasula.
COVID-19 has plunged the world into a crisis of unprecedented scope and scale. In Uganda, the pandemic has and continues to worsen the country's development challenges of poverty, unemployment, and limited social protection coverage.
Almost 90.5% of the service sector is women and youth, and many of them were unable to work during this lockdown, so they've been severely impacted, being unable to sustain themselves. And more so, this has increased poverty, especially among women, because when you look at women in the informal sector, majority of them are the sole breadwinners in their homes. This has an impact. When they've lost their jobs, their livelihood has hung in balance.
The Ministry of Finance, Planning and Economic Development provided preliminary assessment on March 20th, 2020 of the short-term impact of the pandemic, anticipating the increase in the number of poor people by 2.6 million. The Business Climate Index published by the Economic Policy Research Center estimated that 4 million Ugandans could lose their jobs and source of livelihood if the coronavirus pandemic persists for the next 6 months.
Yeah, as Platform for Labour Action, we've continued to give legal aid to workers and also to work on labour issues. We are continuing to really interrogate policies and make recommendations of how these workers can best be supported.
Platform for Labour Action, in consortium with the Eastern African Sub-Regional Support Initiative for the Advancement of Women, EASI, is implementing a 3-month rapid response intervention supported by Urgent Action Fund, aimed at amplifying the plight and voices of women entrepreneurs, traders, farmers, and workers to mitigate the risks posed by COVID-19 to their economic survival.
Under the thematic area of economic justice, we have provided a rapid response grant to a consortium of women's rights organizations in Kenya, Uganda, and Tanzania. And this consortium is coordinated by EASI, a sub-regional organization that is working together with other cross-sectional organizations within the East African region. And the essence of this grant is to document and amplify voices of the impact of COVID-19 towards women's small-scale and medium enterprises.
As a EASI, we've mobilized sister organizations across the region in Uganda, Kenya, and Tanzania. Here in Uganda, we are working with the Platform for Labour Action to ensure that we get the full story. We are able to tell our story. This initiative is funded by Urgent Action Fund, who are our partners. We don't see them as donors. They are more of our partners, and we hope that by the end of the day, we shall have a complete picture of the effect of COVID-19 on women, and at the same time we are able to come out with mechanisms on how we can address the impact.
Tubadde twagala ne gavumenti ffe nga ba domestic worker etuwe minimum wage tumanye nti noba buli mukozi yenna agenda okukola waka w'omuntu atandikira oba ku mitwalo 10 okweyongerayo. Eriyo abakozi abali eyo ng'omukozi akolera emitwalo 5 mu butuufu emitwalo 5 ssente naye tezikyalina kye zigula.
And the recommendations we can give to this, one of them is it's critical that women are enabled as decision makers in the recovery plans. They have a strong understanding of the communities that are and are best placed to address the disproportionate impact of the crisis on women. Fundamentally, all policy responses must embed a gender lens and account for women's unique needs and responsibilities and perspectives. Also, government should invest in reskilling and retooling of women and young women to enable them diversify and establish alternative enterprise that provide productive solutions for enhanced economic recovery. Also, increase on the innovative financing for women-dominated enterprise and recapitalize their enterprise by putting cheap credit, interest-free startup capital with a grace period of at least 3 to 6 months. And it should be noted that government of Uganda was able to secure an interest-free loan from the International Monetary Fund worth at least 1.8 trillion Uganda shillings or $491 million. And to help recover local businesses, the money which was reflected in this money was reflected in the national budget. Part of it is to recapitalize Uganda Development Bank to enable small and medium enterprise access capital to generate liquidity for the finance factor. This means that government is able to support these enterprises so that women can benefit